Hello, I am Paul DeMars, Dr. Paul DeMars, a veterinarian here at the Oklahoma State Veterinary Teaching Hospital. And today we're going to be talking a little bit about ticks in your animals.
Thank you so much for joining us today. One of the things that we keep hearing is, the ticks are really bad this year. They're just so bad this year. Can you talk about what that atmosphere is actually like?
Sure. Ticks, I think, are bad every year. I think every year we hear the news that this year it's worse than ever. We see ticks year-round in our animals. Certainly summertime is a worse time than others because of the weather and the nature of the tick.
And what are some safety steps that people can take for indoor pets, but also outdoor pets who are out year-round?
Sure. Tick control is never going to be a single agent. Every product that we have for tick control has failures. The big thing about ticks is, unlike fleas that live on our pets all the time, the tick is only interacting with our pets when it's seeking a blood meal. Killing the tick is one step, repelling the tick is another step, but really environmental control measures like keeping your grass cut short and picking up leaf litter debris, creating little barriers around your yard that are hard for ticks to come across. Ticks don't like direct sunlight, ticks don't like dry conditions. And so those can radically change how many ticks that we need to try to keep off of your pet.
That's excellent information. What about trees and the wooded areas?
Yeah. So as we talked about before, ticks don't like direct sunlight. So any shaded area is going to be where they're going to congregate. They also like tall grass because they want to be up on an object so they can get onto an animal easier. They like hiding under the leaf litter. So raking the old leaves up, clearing brush, keeping grass short is going to be very effective at stopping ticks.
Excellent. And so in addition to those environmental things, what are some good options for tick prevention medications?
Right. Your veterinarian, of course, is going to be your best source for information. Each animal, each situation, each environment is going to require an individual approach. We now have a whole host of oral medications that are proving to be very effective. Products like NexGard and Bravecto and Simparica and Cielo are some of our newer flea and tick products. The Sinestro collar has a repellent activity, and that is one of the products that is actually even safe for cats. Cats, unfortunately, they're not going to get as many ticks on them as dogs, but the diseases that ticks carry for cats are even more deadly than they are for dogs. So these Sinestro collars can actually prevent the tick from getting on them in the first place.
What are some of the consequences of not treating your pet and the health risks for those?
Sure. Ticks carry diseases, not only for dogs and cats, but for people. Some of the diseases we see here in Oklahoma are Ehrlichia. We don't see very much Lyme disease, and for cats the disease is cytozoan. Many people call it bobcat fever. So the bite of the tick has to attach for a certain number of hours to transmit these diseases. And they can be either an acute or chronic impact on their health. And many of these diseases can also be contracted by humans from the tick, not directly from the animal.
That's really interesting. So what about people who have indoor and outdoor pets?
Right. So the dangers to human health, it would be that the animal has the tick on them and then the tick comes off the dog or cat and gets on the person and bites the person. Okay. There's nothing that they're going to transmit directly from the dog or from the cat to the person. It has to go through the tick.
And we do have a question that's come in here. It says, what are the warning signs I should look for in my pets that might indicate they have a tick-carried disease?
Sure. For dogs, the signs can be very vague. The main condition is going to affect the number of blood cells that they have, and so they'll present mainly with weakness and lethargy. They cause a fever, so they're not going to be feeling well, they're not going to be eating well, they're not going to be doing their normal things. For cats and cytozoan, the signs are very similar, only much more dramatic. Cats, of course, love to hide their illnesses until they're really sick, and so if your cat is not eating or acting lethargic, it really needs to be seen by a veterinarian sooner than later if we're going to have any attempt to try to treat that disease process.
What's the proper way to remove a tick?
There's lots of, I think, proper ways. Probably the one that we promote the most are using one of those tick spoons. I know many of the companies actually are giving them out this year through your veterinarian, but they're all over the place. Anything that you can grab a hold of the tick with and remove it is the best way. The old adage of leaving the head behind is really not true. That's a reaction to the cement that the tick uses to attach itself to the body. And so you're not leaving anything behind when you pull out a tick. Things like fire or alcohol can be dangerous, of course, so you wouldn't want to use those techniques.
So there's different sizes of ticks and different types of ticks.
Yeah.
Are any more threatening or more prevalent in our area?
No, Oklahoma's blessed with virtually every species of tick. We are called tick heaven. And so we see everything here. I wouldn't consider a certain tick more dangerous than another, like in the Northeast with Lyme disease.
How long does a tick have to be on an animal in order to transmit a disease?
The general thought process is probably 24 to 48 hours, and most of our products are killing right at that window, so we're barely winning the race.
Is there any research going on to try to improve those medications?
Constantly. I'm not involved with anything specific here, but just the fact that throughout my career, I've seen an improvement in the control measures and the safeties. When I graduated in the 90s, we were using products that weren't very effective and had a lot of side effects in animals. We were taught how to treat these side effects in animals. I no longer see those side effects. So as we've gone through the products from the front lines and the advantages to now the NexGards and the Bravectos and the Simparicas and Sinestro collars, we increase the effectiveness of the product and we increase the safety of the product.
And just to kind of touch on the facility that we're at now at the small animal clinic here at OSU,
Sure.
It is open to the community. You want to talk a little bit about the services that are offered here?
Sure. Here at the teaching hospital, we have a variety of different specialties. Myself, I work in what's called community practice, and we are tasked with serving the community. So we are a primary care service like any other veterinarian that you might go to. We are teaching our students how to do this role, and we need good clients and good patients to actually fulfill that mission. So we are open 5 days a week, Monday through Friday. And then, of course, we have our specialty services that your veterinarian can refer your pet to, or you can call up and get an appointment with directly. And then, of course, we have our emergency services after hours. We have a doctor in the building at all times and a fully staffed 24-hour hospital unit.
That's excellent, an excellent resource for the community. I want to thank you again for your time today. That's all the questions we had. Thank you so much.
Thank you.